This is Dr. Marianne Martin, and I wanted to drop this video for anyone curious to learn about Platinum's newest product, LiquiXO. And before we start, I just want to share that as an endocrinologist, I have been on the front line of metabolic health for over 20 years, and I have seen a very concerning reality, which I'm sure you have too. Many patients who are on a GLP-1 drug like Ozempic are losing extreme amounts of weight, but they are also losing extreme amounts of muscle called sarcopenia. This is not the outcome that we want. We don't want people to be smaller, but to also then feel weaker, more frail, have more falls and fractures. Now, at the same time, I was looking for something that was going to dramatically help my patients not only maintain their muscle mass, but also help with exercise recovery, to reduce inflammation, and to manage pain. And it also had to bypass the liver and the kidney and not put any extra burden on them, because my typical diabetic patient is on 8 or more prescriptions or supplements, and adding more risk was not an option. And because the product didn't exist, I, with the help of Platinum Biologics, was able to develop LiquiXO for those purposes. But before we get into that, I think it's important that everyone know that at the age of 30, we all already are starting to lose muscle mass at the rate of 3 to 8% per decade. Now, that is going to be 10x on anyone who is losing more than 2 pounds a week, whether it's on a calorie restriction or on a GLP-1 drug. In fact, people who are on drugs like Ozempic, up to 40% of their weight loss is muscle. So if they lost 40 pounds, up to 16 pounds is muscle and bone, not fat. And the biggest issue is that when they go off these medications, they are regaining only the fat. They are not regaining muscle or bone. Sorry, it's outside and we've got gardeners working on the golf course. So let me repeat that. Again, when someone is on a GLP-1 drug, up to 40% of that weight loss can be muscle. And when they regain the weight back, when they go off these medications, they are only regaining fat. They are not regaining muscle. And so we want to make sure that when we're talking about essential amino acids, that first of all, the background on that is they are the 9 essential building blocks that our bodies cannot produce. And essential amino acids are required for muscle protein synthesis. Leucine is the most powerful to initiate muscle synthesis, but you need all 9 to sustain it. And in our current era of highly processed foods and GLP-1 drugs and extreme intermittent fasting, people not getting enough protein in, the majority of the American population is not getting the adequate amount of EAAs. But the other thing that I was mindful of in creating LiquiXO is the route. Before LiquiXO, the only form of essential amino acid available was in the oral form, either a powder or a tablet or a capsule. The reason that I chose an IV is to make sure that we capture 100% bioavailability. We have so many people in our country who do not have good gut health, which means they have a leaky gut. Whatever they're eating, they're not absorbing all of the nutrients. We don't want to add to that problem by having an oral form of something as important and crucial as essential amino acids. So LiquiXO is an IV form of essential amino acids, the very first to market. And that is important because the oral essential amino acids, up to 47% of it is lost in the gut. And also, one dangerous thing about oral essential amino acids is it does spike insulin because it's helping to release something called GIP. So in the IV form, we're not spiking insulin, and we're getting 100% of the EAAs to where it needs to go to do its job of protein muscle synthesis. Now, I wanted to highlight all the people that LiquiXO was designed for, because it's not just for people who are on a extreme caloric restriction, losing a lot of weight, or on GLP-1 drugs. So here is your primary targets to consider. Yes, for sure, weight loss clinics who are having a lot of GLP-1 users in their patients, but also let's think about women who are in perimenopause and menopause. Because their estrogen is declining, they are at risk for 3 reasons. Estrogen is there to help with muscle preservation, and now they're going through this decreased estrogen state, so they're already losing more muscle because estrogen is going down. Number 2, estrogen also acts as a natural anti-inflammatory, and because LiquiXO is combined with exosomes, we're now helping make up for some of the anti-inflammatory jobs that estrogen was doing. And third, in perimenopause and menopause, again, when estrogen declines, cortisol goes up. And when cortisol goes up, you have more catabolism, which means you're breaking down muscle for energy. So please think of LiquiXO for any woman who is in perimenopause or menopause. You're also going to think about LiquiXO for patients who are post-op or recovering, they're sedentary, they're not able to be active. They absolutely need something to help preserve their muscle mass. And finally, hang on, the last population. They're almost done. The last population that you want to consider is wound healing, because we know that exosomes specifically are going to regulate amino acid metabolism to ensure that you have a proper metabolic environment for healing. So those are all your target populations for LiquiXO. People who are on GLP-1 drugs, perimenopause or menopause women, people who are post-op or in recovery and are sedentary, and wound healing. Now, the final population is athletes or people who want to operate at peak performance. These people are definitely going to feel much better on EAAs. They're going to be able to push their bodies to that next level. So they are a population that you don't want to forget as well. Now, just as important as knowing who your target audience is knowing who LiquiXO is not for. So there's only a few categories of people that should not be on LiquiXO. These are people who have active cancer. They have active infection. They have significant they are significantly immunocompromised, let's put it that way. They have liver or kidney disease. And finally, if they're breastfeeding or pregnant. Those are the only populations that I would not recommend LiquiXO for. But the bottom line is this. Whether you're speaking with a healthcare provider or a patient with LiquiXO, nothing is going to be more powerful, memorable, or compelling than a story. And so I want to share with you 2 of my own personal experiences with amino acids. The first one was actually a few years ago, before we even had LiquiXO. Boy, do I wish we had LiquiXO back then. But this was when my husband and I were living in Florida, and we have two very large dogs that each weigh 60, 65 pounds. I was walking them, and my mistake, I was wearing flip-flops, not tennis shoes, and I was also walking in grass that was just a little bit wet, because in Florida, it rains a lot. Because of all the new smells and new animals, our dogs picked up a scent, and they ripped this shoulder pretty hard. And I'm a competitive tennis and pickleball player. I probably had 30% mobility. I probably couldn't even raise my shoulder past this point. I started taking oral EAAs every single day, and within 3 months, no anti-inflammatories, nothing. I didn't take Advil, I didn't take Motrin, I didn't take Tylenol, I didn't take anything. Within about 2 to 3 months, I had 100% mobility and strength back, and I attribute that 100% to EAAs, because that's the only thing that was different. And I know instead of taking 2 to 3 months, had I had access to LiquiXO, that would have been a fraction of the time. My second experience with LiquiXO was when I was at a Regen Summit recently, and I was able to have the IV infusion. 3 hours later, I did a workout at the hotel gym, and I was able to go longer. I was able to have more weights. I was able to do a higher incline on the treadmill, and I wasn't sore the next day, and I was able to sustain that higher level workout for another 2 weeks. So I invite you, I want to invite and encourage everyone, please try LiquiXO for yourself. Have your staff try it. Have your family members try it. Let's all gain some personal experience and stories about it. Post it in the Facebook page so that we can all learn from each other. And over the next couple of weeks, we'll be dropping some videos on specific patient cases and what the protocol was and how they did. Hi, everyone.